Hi! So our bodies function best when they're able to leverage proper alignment and posture. Due to highly stressful demands of living in this day and age, we could all use a reminder to sit up taller and stand straight. This is what I constantly have to tell my two boys and, of course, my patients. And there's an increased interest in health and wellness lately, as most people are realizing that we must take responsibility for our own health. But knowledge doesn't always translate into behavior. So today, I want to dive deep into the importance of paying attention to your posture and alignment. Most of us are unaware of the degeneration that occurs with simple aging. As we age, we all degenerate as the body experiences wear and tear. Most of us get regular alignment checks and oil changes for our cars, but when it comes to our own body, we don't apply the same care. As a physical therapist for over 19 years, I've witnessed patients who lose their ability to move due to sudden low back pain, motor accidents, or even a fall. Many people are in this category where they're injured and received physical therapy, and they made some improvements but were discharged because their insurance benefits were exhausted or because it became too expensive. Then they go back to their normal lives and forget about the injury until it comes back. And the pain and injury comes back because too often we don't take the time to properly heal. With increased deductibles and higher copays, the insurance model is making the service of physical therapy a commodity, where everyone is treated with short window of time dictated by the limits set by the payers. And it's all too common for us to treat the patient until the pain subsides. But the follow-through of fully healing and establishing proper muscle memory is so important for overall longevity and health. How do I know? I've witnessed the results of poor physical rehabilitation in the assisted living facilities that I've worked in. Our muscles are the organ of youth. It's in our best interest to make our muscles strong and stable to the point of hypertrophy. This means we're actively building muscles to prevent atrophy or shrinking of our muscles. Everyone will be subject to injury at some point in their lives. There are many of you who are unaware of your postural dysfunction simply because you've never been assessed. So I'd like to talk about our bodies by providing an overview of tissue healing and phases of rehabilitation so that you understand how to better take care of your body to allow it to heal. There are 3 essential phases to physical rehabilitation. First is the inflammatory phase, which can last from 1 to 7 days. At this phase, your body starts chemical and vascular responses that promote increased blood flow to the injured area. The main goal at this phase is to decrease swelling and pain. Second phase is the repair phase, which can last from 4 days to 6 weeks. You should be working with a licensed physical therapist at this phase. At this phase, your body begins to settle down and begin the repair process by laying down new collagen. And it's so important to remember that the new collagen is much weaker and less flexible. And there's less pain, but it's important to be cautious because this is where one can be at increased risk for re-injury. The main goal at this phase should be to regain range of motion, do exercises that promote realignment, and focus on neuromuscular re-education to avoid compensation and encourage proper muscle memory. The third phase is the post-rehab phase, which can be between 6 weeks up to a year, depending on the injury. You should be focused on improved quality, motor control, and proper dynamic movement patterns. And it's important at this phase to add adequate stress to the tissue to ensure that muscle is growing. Main goals at this phase is to improve strength, increase the muscle size, and increase resistance, and ultimately return to functional ability prior to the injury. If working with a proper team of professionals, your progress should exceed your expectations. We believe the post-rehab phase is where most injuries occur. Many people go back to the gym and hire a personal trainer, only to be injured again and back to square one. I've seen many patients fail to gain traction out of the phase to the point where it becomes the turning point for their physical decline. They're in too much pain to move, so they stop moving, gain the weight, and become metabolic mess and end up dependent on an assistive device, ultimately will lead to assisted living. I'm hoping that this won't be you. So let's talk about the importance of building muscle mass. First off, it's important that physical activity becomes a habit or lifestyle. Building muscle and changing your body composition is very possible, but it takes time and commitment. Initially, when beginning a training program, your brain will become smarter. Your brain is your connection to your muscles. And when the brain learns, the connections grow and the body becomes more efficient. This happens in the first 1 to 2 weeks, and as a result, you'll feel stronger. Then we must build muscle. You need to train consistently for 6 to 12 weeks to allow your muscles to physically grow. This is called muscle hypertrophy, where the muscles go through micro tears in order to repair with new tissue, increasing your lean muscle mass. So as long as you keep progressing, you will keep getting stronger. Along with progressing your workouts to challenge your muscle, it is also important to have the right diet so that your body has the nutrients it needs to build muscle and give you energy. Our post-rehab protocol at Alkaline Wellness is created in a way that a physical therapist will guide you through the process, applying the different stages of healing and adjusting your program so that your body is optimally challenged without the risk of injury. We have 3 types of programs for every phase. First phase is Alkaline Recovery. This is where you begin to take back your life and take responsibility for your health. We get you on an individualized program specific to your needs, making it affordable and economical, competitive with your in-network benefits with your insurance. Second is Alkaline Rehab. This is where you learn how to strategically take care of your body and begin to own your health. During this stage, we provide you with the tools to take your recovery into your hands while still being supervised and instructed by a physical or licensed physical therapist. This would be a membership level service here. Again, it's economically priced, so it's a no-brainer for you. The third phase is Alkaline Revival. This is where you'll find that living alkaline is a lifestyle. You now have full control over your health and body to a point where you now feel younger and stronger than ever before. You can now understand the difference between chronological age and physiological age. This is our goal and commitment to you. This is why we're different. We want to be the liaison between sickness and health and help you to shift alkaline so that you can be the best version of yourself. We hope to see you at our studio or center. Make an appointment with one of our alkaline health advisors today.